welcome in. Welcome to PCS Wednesday. Hope everyone managed to keep dry today. I got drenched. I don't know about you guys, but welcome on in. Tonight we're going to have a nice little half an hour session, but some important information is going to be shared. So thanks for your time and welcome on in. Tonight we're talking about a hormone called prolactin, which at first glance you'll see milk and breast milk production and how does this impact me, but it impacts everyone. And it's important to know about this one because a lot of times your doctor may have missed checking on this and it could explain a lot that you're going through. So welcome on in and thanks for your time. My name is Dr. Joseph. I am the medical director at Azalea Health Services and I take this time. I just came out of clinic at the hospital, so I had to make it for 8 o'clock. I'm going to take this half an hour just to make sure that we are better aware of what's going on with our body. So welcome on in and thank you for your time. So tonight we're talking about prolactin. What is it? And is that the reason why sometimes our periods are a bit irregular? Is that the reason that sometimes I may make breast milk when I'm not pregnant or I haven't ever been pregnant? And this is an important hormone to understand and know about. So the first thing I want to show is where this is made. So prolactin is basically produced in the pituitary gland. I don't have a pointer to show you guys, but this is the brain. Don't overthink it, like literally don't overthink it. But if you look at this picture of the brain, right behind the eye, and you just kind of draw a straight line across from behind the eye, there's a tiny gland that sits behind our optic nerve. That's called the pituitary gland that really controls all of who we are. We're nothing without it. And this gland is actually a small bean-shaped gland situated at the very base of our brain. And despite its small size, the pituitary gland influences nearly every part of your body. The hormones made in this gland help regulate important functions such as growth, your metabolism, your blood pressure, and your reproductive function as well too. So prolactin is a hormone that's made by that tiny little bean in the middle. I don't have a pointer, I don't know why I'm pointing, but if you kind of look past the eye and go straight back, there's a little gland there that sits there that produces this hormone. So sometimes when you come in for a visit and your periods are irregular, I will ask about any vision disturbances, floaters or spots in your eyes, severe headaches, because sometimes it's not at the level of the ovary, but the problem is more at the level of this pituitary gland that we all have and we all need. So prolactin hormone is made by this little bean-shaped gland in our brain. In men and in non-pregnant women, it's supposed to be pretty low. And it's a hormone that's originally named after its function, which is to make breast milk or lactation in mammals. It's made in response usually to the suckling on the breast. Now, that's a suckling of a young after birth, a young mammal. So the mother would have gone through some changes in the pregnancy to allow this to be possible as well. Right? Thank you for locking on. Now, it's since been known that this prolactin hormone actually has more than 300 functions in our body. They can even break it down into different areas. So it's not just for breast milk production, which is why men need it as well too. It functions for your reproductive health. Prolactin surges when you orgasm. Prolactin plays a function in your sex drive, your libido. It works in your metabolism and how your body processes your foods. It regulates fluids that go in and out of our cells. It regulates the immune system and also our behavior and our moods as well too. So in humans, prolactin is produced both in this part of the brain that I show here in the pituitary gland, but also they found, again, it has over 300 functions in the body. So they have these cells called lactotrophs that produce it as well independently of that pituitary gland. These can be found in the uterus. These can be found in the immune cells. It can be found in your brain and other areas, and the breast, the prostate, the skin cells, and fat cells as well too, because remember, it plays a role in your metabolism. So the whole point of tonight is to understand that if you are being evaluated for irregular periods, prolactin is a hormone that we definitely can't leave off, and a lot of times it's forgotten. One of the main regulators of our prolactin levels in the pituitary gland is actually a hormone we made called dopamine, right? So dopamine is produced higher in the brain, in the hypothalamus, and it sort of creates that pattern of production of prolactin in the pituitary gland. Now, the dopamine acts as what we call a neurotransmitter, sending messages between nerves. And dopamine as a hormone is a catalyst that really works to put prominence in humans and mammals and animals. The dopamine gives us the assign importance to tasks that we associate with pleasure, reward. So this hormone is important for that. So as dopamine rises and we get enough of our prolactin, excess dopamine then will shut down the prolactin, and that's just how it regulates it, right? So the more dopamine there is, the less prolactin is released. So again, don't overthink it, but I just am showing that this is a very integral hormone. The other way that prolactin is regulated is by our estrogen. And I always talk about PCOS and estrogen. Some forms of PCOS, you end up making excess estrogen, and here's estrogen, another regulator of this hormone prolactin. So which is causing me to have my irregularities, which is why it's important to check your levels if you're experiencing irregular periods and other symptoms, which I'll go through now. The estrogen has been shown to increase prolactin production from the pituitary gland. And they even have studies that show that small increases in the blood in women during their reproductive cycles are linked to exactly when the estrogen peaks, which is usually about mid-cycle, and our prolactin levels peak then as well too. Again, this is linked to hormone, to your orgasms and your sex drive and breast stimulation. So it's all rolled in together. And then, of course, in pregnancy, when estrogen is the highest it will ever be in a woman, it makes sense that this higher level of estrogen produces higher levels of prolactin towards the end of the third trimester, about 2 months, 1 to 2 months before babies due, and breast changes begin where lactation will occur. Now, what happens if you have too much prolactin, right? Because if you're not pregnant or you're a man, you need it, but in very small amounts, and it surges at different times. But if you are not pregnant and it's elevated, what happens? So the condition of having too much prolactin in your bloodstream or circulating blood is called prolactinemia. The most common cause is, of course, pregnancy, which I mentioned. There are medications, especially if you're on like an antidepressant or an antipsychotic, that impacts your dopamine levels, right? That pleasure and reward hormone. Then your levels will be increased if it's suppressing your dopamine and so forth. Thyroid disorders, if you have a hypothyroid disease or underactive thyroid, you tend to have a little bump in your prolactin more than you need as well too. And again, this one is most frequently missed by doctors who aren't familiar with the fact that this can impact you and impact every part of you as well too. And of course, a prolactinoma, which is a benign tumor in the pituitary gland that I just showed you all. And the prolactinoma is a benign tumor, won't kill you, but it is the one time that I may, as a gynae, maybe about 3 or 4 times for the year, I would be telling someone at a gynecologist visit that they have a brain tumor. Prolactinomas are benign, meaning that they won't kill you. They're more annoying than anything else because the symptoms are really gradual as this growth is happening. I showed on the slide the location of the pituitary gland. It's a direct line drawn from the eye socket back. It's large growth can impact the optic nerve and influence your eyesight. You can have nausea, severe headaches, and still not know what's going on. So it's a benign tumor, but it can cause compression and other issues. So symptoms of elevated prolactin in your blood would be the unwanted production of breast milk, right? Again, I ask women this all the time, and 9 times out of 10, luckily, they're like, what? No, I don't make breast milk. But sometimes people do. And again, it's a very chronic, once in a while, you don't really pay it any mind, and then all of a sudden you start actually lactating. And that's when the prolactin levels have really exceeded where you need them to be. Disturbances in the menstrual cycle will happen then as well too, and other symptoms due to lower estrogen as a result, or in men a testosterone deficiency can happen, right? So that's important to understand. On the flip side, you can have too little of prolactin, And that's when you need it. I just spoke about it having over 300 functions in the body: skin, metabolism, your reproductive system, your moods, the pathway for orgasms. So if you don't have too much of it, it's called hypoprolactinemia. It's very, very rare to have this happen. And in general, this person may have that gland just in general just be underactive, which is the pituitary gland. They will have more of an issue in making breast milk when they're have had a child. They may have insufficient breast milk production. And again, this is hardly ever checked, but we may be missing women who haven't made any breast milk who actually may not have had sufficient prolactin at that time. Most people with low levels do not have any specific medical problems, so we tend to focus more on the people who have higher levels because a lot more could go wrong with them as well too. But we do know that the prolactin does play a role in our immune system. So if your prolactin levels are on the low side, you may actually have reduced immune responses to infections, right? So too much prolactin, spontaneous breast milk production, even though there's no baby in sight. You have excess hair growth, and it mimics PCOS in this way. Acne, headaches, visual changes, and mood changes as well too can be prevalent. Too much prolactin also inhibits the secretion of another hormone from that gland in our brain called FSH that pushes your eggs to grow. So here you are making too much of this hormone. There's no child in sight, no pregnancy, but you're making breast milk. And then on top of that, you are inhibiting your eggs from functioning. And without that egg growth and stimulation of that follicle, there's no ovulation. And without ovulation, it's pretty much impossible to get pregnant. So that's how that loops around, right? That's why I, strangely enough, will ask in the office, do you make breast milk? And again, irregular periods is part of that as well too. Now, prolactin will cause a woman's breast to grow and make milk during pregnancy and after birth. Again, here's a mammal, cutest ever baby, and all mammals make this hormone, and the infant suckling on the breast is supposed to really trigger a pretty decent supply of milk for as long as that infant needs it. So prolactin levels are normally quite high for pregnant women and for new mothers. Now, when women are pregnant or have just given birth, first of all, we don't check it at this point in time. The prolactin levels can be really excessively elevated, but it is possible to have high levels of prolactin even if you're not pregnant and even if you're a man. So again, that little nipple discharge that starts to get a bit more constant. Definitely if you're triggering, just like this child is suckling, if you're pressing on the nipple and squeezing, you get even more of this production because you're actually triggering that reflex that we all have built into us, whereas nipple stimulation can promote it as well too. Luckily, you can easily check your prolactin levels with your doctor, but you can easily do so with a blood test. A few things are important to note when you get your blood tested for prolactin. You must be fasting. So I talked about all the different areas in our body that this hormone affects, from skin, hair growth, your orgasms and your libido, nipple stimulation. So before getting this test, my instructions are usually you should be fasting, so you shouldn't be digesting any foods because it does impact metabolism as well too. You should avoid having any sexual activity or pleasure or orgasm, masturbation, nipple stimulation for at least 24 hours, and then you get your levels checked. It's usually a test where if it's within range, I would say, oh, everything's fine and we don't need to keep checking on it unless there's an additional problem. So let's say you do make some form of breast milk and we check your levels and they're within the normal range, which I've posted here. We would then look for other sources of maybe a cyst in the breast or a breast duct, milk duct issue. We'd more do imaging, breast ultrasound, and most times if we don't find a problem, we're like, just leave the boobs alone. And the breast milk production usually tapers off with less stimulation. But these ranges are important. Sometimes the range is sort of skirting on the boundary and we don't want to turn our back on a mildly elevated or borderline value. So I may check again in a year or in 6 months, depending. So if you're within range, it's not an impetus to really keep pushing and checking for this. We look for the other reasons as potentially why you might be making breast milk. But this is an important test that we must get done. right? Now, the prolactinoma that I speak about, and it's usually a little bit of an awkward visit when I have to explain to someone why their periods are being irregular and why they would get sometimes these, not excessive like male pattern hair growth, but definitely get whiskers, and they may have some acne issues as well too. A prolactinoma. So on this MRI, which is the standard imaging, the results of the blood test that I just showed, those ranges, usually if a prolactin level is over 100, that's like the gold number, then we order imaging. Definitely if it's in the thousands, you would definitely need to be seen by a specialist, and they would order this image. The prolactinoma, if you look to the very center, again, the marker to look for the pituitary gland is behind that eye line, right? Which is why vision changes and waking up with nausea, because there's this mass at the base of the brain, and it can be there for a while, gradually increasing in size. So it's non-cancerous, usually remains quite contained, it doesn't spread anywhere, but it does compress additional things that are next to it. It's non-cancerous again, so no radiation, no chemo. This is usually well treated with medication, and it's very rare to have to do surgery. Maybe way back in the day, they would try to do a transsphenoidal access and go through the bone and go through the sinuses to get to this tumor, but it does reduce quite considerably and even resolve with medications as well too, which is awesome. So in the visit where I'm telling someone they have one of these, it's sort of a bittersweet. Yeah, you have it, it sucks, but here's what, we're going to fix this. And the question is always, will I forever stay on the medication? A lot of times there's a chronic need for the medication to suppress the gland from becoming overactive and forming this growth again, right? And this is a tumor that you see in the center of the screen that actually causes overproduction of the hormone prolactin. So this prolactinoma that you see here is pretty decent size, but it still isn't life-threatening, as I'm saying. This one will cause vision difficulties because it does compress on the optic nerve. It will cause infertility because it suppresses ovulation and it suppresses the eggs from coming. And if your doctor has not tested this level and they see some signs of PCOS on the ultrasound, but they didn't do blood work, they'll probably say, oh, you have PCOS, that's why your periods are irregular. But this is way more than PCOS. This causes irregularities in a few other ways, and definitely infertility. So a woman with PCOS can still be managed and conceive under the right circumstances, but there's probably absolutely no chance of pregnancy with this guy that's present here on this scan. It is the most common type of hormone-producing tumor in humans, and it develops in the pituitary gland, so it's considered the most frequently diagnosed, but it's still a functioning tumor, so it's a tumor that's making hormones. And also it's about 40% of all the different types of tumors that could happen in this gland. So imagine you have these period irregularities. You've Googled and Google tells you it's PCOS. You went to your doc and your doc tells you, yeah, you're right, it's PCOS, but they didn't check this prolactin level. We could be missing an entire growth in the brain that eventually will declare itself, but it's always best to catch these things earlier. Now, a prolactinoma might not cause any noticeable signs or symptoms until it actually causes excess levels of prolactin in your blood. So the elevated levels was one way to know that you have this, as well as just pressure on the surrounding tissues from the tumor can cause signs and symptoms. This happens, again, not as common as PCOS does in the population. It is more common in women to have this tumor, and it's particularly more common in women who are of reproductive age. The highest incidence worldwide is found in women between age 25 to 34, and I certainly agree with that. Most of the times when I have patients with this type of tumor, they're about 28, 30-year-olds. The average age worldwide, they say about age 24. Age 24 is the average age when it happens. And then the major effect of this type of a tumor is decreasing your sex hormones, so your FSH and your LH and all the other ones you need for your ovaries to work are decreased. Estrogen drops in women and testosterone falls in men. right? In women, this tumor will cause your periods to be irregular or no periods at all, like they just won't come. And I like to just simplify it to say, here's this tumor making breast milk, confusing your system, and your body's like, is she pregnant? Should I send an egg? What should I do? So the whole shebang is shut down and you just don't ovulate. And then there's a milky or milk-like discharge that comes from the breast and you're not pregnant or breastfeeding. Painful intercourse is the third most common symptom of this, and you don't connect a brain tumor to having a painful intercourse, but painful intercourse due to vaginal dryness is the third most common. And then the fourth most common symptom, if you do have a prolactinoma that's making too much prolactin or milk hormone, is acne and excessive body and facial hair growth. So look at these symptoms and tell me that doesn't sound like PCOS. Irregular period, well, besides the breast milk, irregular periods, which everyone doesn't always get, vaginal dryness, painful intercourse, and then acne and excessive body and facial hair growth. With prolactinemia, you tend to get very fine hair all over the body as opposed to the coarser hair of PCOS, but it is another symptom as well. In men, this tumor, and again, I said it was more common in women, average age is 24, woman age 25 to about 35. But in men, they get erectile dysfunction, they get decreased body and facial hair, and they get more uncommonly, right? Less commonly, sorry, they get enlarged breast size. So a young man with erection dysfunction, being told by his doctor that he's stressed, really should have a prolactin level checked as well too. And of course the decreased body and facial hair, because it does decrease their testosterone level, right? And in both sexes with this tumor, the bone density is impacted. I mean, this one hormone, again, they've listed over 300 things that it affects. So bone density and easy fractures, so breaking a bone as an adult, reduction of other hormones that should be produced by this gland starts to happen as well. Decreased libido, which is essentially loss of interest in sexual activity, frequent and daily headaches. I mean, look at it, right? It's in a position where it's compressing things and your vision is disturbed, and of course, infertility as well too. So it doesn't always look this big as you see on the screen. In women, prolactinomas are about 1 centimeter in size on average when they're picked up, usually by the high prolactin levels in the blood, which is checked because of lack of periods or few periods, breast milk production, and of course difficulty conceiving. Men actually may present later with it, so the size of their tumors actually get to a bigger size because they don't get monthly periods to track, right? So if my periods are weird, I'm going to find out sooner. In a man, it's headaches. It's, again, erection dysfunction, as I said, decreased body hair, infertility, and then eventually they may present with loss of vision because their symptoms are more sort of obscure, and this tumor is allowed to grow in size. And then the long-term consequence if this is not diagnosed is loss of bone density in men and in women. So basically, with this prolactinoma, which is producing excess prolactin hormone, women tend to notice the signs and symptoms earlier than men too, which makes me think they say women actually have a higher incidence, but is it that we're diagnosed more? But men less, women more. And the women are diagnosed when the tumors are smaller because the symptoms are more obvious when you have an issue with your period or you're making breast milk and again, there's no baby inside. That's probably why men tend to notice their symptoms later when the tumor actually has a chance to get large enough to affect their vision and cause headaches. So again, your doctor may order this prolactin blood test for women for irregular periods, difficulty getting pregnant, and of course breast milk production. Not just breast milk production, you may also have bilateral breast pain or breast tenderness that cannot be explained. And breast pain is a whole other topic, which I think I did at one point last year. But breast pain can be from drinking too much caffeine or caffeinated tea. Breast pain can be the type of bra you're wearing, or you've gained weight and the fatty tissue density, inflammation in the breast, but definitely tenderness in the breast, along with presenting with irregular periods, warrants checking a prolactin. right? And in more advanced cases, remember the ovaries are being shut down. A young woman, aged 25 to 35, as I said, may start experiencing vaginal dryness and painful intercourse, hot flashes with that irregularity of the period as well too. For the men, decreased sex drive, difficulty getting erections, especially at a younger age, and also breast enlargement. And it's very rare, but sometimes the men will make breast milk. Because of the location and the surroundings and so many intricate structures are there, unexplainable headaches or persistent headaches and vision problems may prompt working this up as well too. So this is a prolactinoma, which is seen on MRI, and this is a benign tumor that's formed in the pituitary gland, which is at the base of our brain, and it produces too much of the milk hormone prolactin, right? Other diseases that can do it, if you have a hypoactive thyroid or underactive thyroid, that can impact your prolactin levels as well too. People who have an eating disorder, specifically anorexia, may have an increase in their prolactin, and of course drugs or medications that might be used to treat depression, antipsychotics, and even some high blood pressure medications, some blood pressure medications can impact this as well too. Because of the location of cells that make breast milk hormone prolactin, called lactotropes, in the breast, it can be mildly elevated if you've had some kind of an injury to the chest area. Studies say even a bra that's too tight can cause a mild bump in this. So sometimes when I check this, if it's mildly elevated, we may check it again another time just to confirm, because even pressure on the chest, having scarring on the chest, injury or trauma in the chest can bump this as well. And then in extenuating circumstances, people with kidney and liver failure and so forth can have bumps in these levels. So if your prolactin levels are high and you're outside of the normal range, it does not automatically mean that you have a problem. Sometimes you could have, again, just eaten, or you're just under a lot of stress when you get the blood test. So for me, when you go for testing, you should be fasting at least 8 hours, avoid any sort of sex, nipple stimulation, orgasm, or so forth. And then we can know if the elevated levels are valid or not, right? Now, what's also important, I have one more thing to show you guys here, is when it's elevated, what can we do for it, right? So you can be prescribed medications to lower prolactin levels. So again, if you're diagnosed with this tumor, it's usually this weird freak out moment when I tell someone they have it, but then it makes sense when I explain what it means. And it doesn't mean any surgery usually, definitely no chemo, no radiation. This is a benign tumor that responds really well to medications. So knowing you have it is actually a win, right, in this case. So the goal is to use medication to reduce the size of the tumor and thereby lower the amount of prolactin that you produce. And the vast majority of people with a prolactinoma, which is the benign growth in the brain, will be treated successfully using medications that mimic the hormone dopamine, which is made in a higher level in the brain that can suppress this. The most common used medication is one of carbogoline that I show here, which actually works on the dopamine, and it is a treatment of size, and you continue it until you get your prolactin levels down to normal, and then the MRI shows that, hey, this tumor has actually come down in size. And almost like clockwork, the ovulation returns, fertility returns, the period returns as well too. Carbogoline is actually preferred over bromocriptine because it's more readily effective and well tolerated in terms of the side effects. But both of these medications appear to be safe, and they can be used even in a woman who's trying to get pregnant. So imagine you're trying to get pregnant and you make too much of this hormone that's reducing or stopping your ovulation. You need to be on something safe that you can continue on until you get pregnant, because you don't want to get pregnant and harm the embryo and cause harm to the fetus. So this is considered safe to use and quite effective. They have to do a lot more studies on the safety of these medications continuing through pregnancy, because guess what? Even if I have a tumor and I get pregnant, I am going to be high risk for so many reasons. But also, I need this hormone but then I make too much of it, so it's almost a balance you try to find. But with these medications, there's been no association with increased risk to pregnancy loss or even premature delivery. So that's important as well too, which is why I put that slide up, because even if you're found to have this elevated level, we still have options to manage and treat it. Back in the 50s, 60s, 70s, 80s, even maybe up to 1990, doctors used to prescribe these when moms were tired of breastfeeding. I don't want to make any more milk. Give me something. But that was banned due to a lot of other side effects and the safety. And if a woman is trying to stop lactating or breastfeeding, we try more natural approaches. First thing we do is stop stimulating the nipples, stop suckling the infant, wean the infant off. We try more behavioral changes. We don't go for these heavy hitter drugs anymore. What's more acceptable is using the birth control pill, which will suppress ovulation and also reduce estrogen, which is a promoter of prolactin production. So we can do that as well. But we don't use these medications anymore to do that, but they used to be at one point in time, right? So that is my 30-minute spin on prolactin. I don't know how many of you guys knew about this hormone before. Show of hands if you did. It's often something that will be missed in a workup for irregular periods and a workup for infertility, and it just shouldn't. So that's why I make sure to put this as a topic tonight, because if you are being seen for irregular periods, then you need to know what your prolactin levels are, right? Does anyone have any questions for me on tonight's topic? Again, thank you for your time. Tonight's topic again, prolactin, the milk hormone made in the brain, and absolutely is a key factor, key player in many ways. Hi, Lori. Good night. I hope you're doing well, and the baby as well. Well, I don't know if he's still a baby, but I hope the baby's doing well, and thank you for joining in. Does anyone have any more questions? And feel free, in any of the lives, you can comment, still go back, you can watch the older ones and ask questions, and my staff will make sure that I'm aware that there's a question to answer. Right, so again, thank you for your time on this Wednesday, and this will be posted shortly after I close off here. And be sure to post your questions. Tonight was short and sweet though, and prolactin, it's not that complicated when you get a nice breakdown like this. Definitely share this with any of your friends or family members that may not have been checked for this, if they may have been exhibiting some of these symptoms. If you've been curious about this breast nipple discharge or milk production you've been having, then definitely this is something that you should be aware of as well too. Right, so thank you for your time, and keep the questions coming, and thanks to all the feedback as well too. And everyone have a great night and a good weekend. Thank you and good night.